All right, and we are live. Good morning, good afternoon, good evening, depending on when you're watching this live. This is the voice and the face of Dr. Tolu Olabintan of Living Spring Family Medical Center here in the city of Mansfield, Texas. Um, I'm so happy to be here today with the awesome Dr. Jess Daigle, and I'll give her a chance to introduce herself. But today we'll be talking about new moms, how to navigate the fourth trimester, and this is a mom and baby, not just baby edition. So I'm glad that you're joining us. If you're watching this live, hashtag live. If you're watching this on replay, hashtag replay. And of course, feel free to share this with as many people as will find this useful. All right, so let's get to it. Dr. Daigle, please kindly introduce yourself. Who are you and what do you do?
Good morning, everyone. So, I'm Dr. Jess Daigle. I am a board certified pediatrician and NICU hospitalist and founder and CEO of Mom and Me by Jess Daigle MD. And so, on my regular job, I work in the NICU taking care of preterm and term infants. And
Mm.
for my business, my goal is to help moms and their babies transition from birth or hospital to home after delivery. I have a passion for helping moms during this period because this fourth trimester, as you mentioned, is filled with lots of changes and anxiety and overwhelm. And I don't know, and I wish I knew. And so I want to be there to be their guide. I say having a baby is a journey. Let me be your guide. So that's me.
I love what you do, Doc. And I can speak to the fact that you have a big heart. I watched you online, and I remember the first time I actually watched you in video talking about what you do, and I said, "Man, I wish I had someone like her when I had my first had my kids." So I love what you do. Hi, Dr. Una. Dr. Una is watching us and says hi. Now, why do you do what you do? Is there a story behind it? And feel free to share that. But why do you do what you do?
Well, ever since I was young, I've always wanted to take care of babies and their families. I read this book of this family who had a preterm infant and the struggle they had in the medical system with wanting their baby to just be able to die with dignity versus like hospital heroics, like we say. And from there on, I said, I want to take care of babies. And so I went on to become a baby doctor, but it became more personal to me once I had kids. And I used to always feel like a fraud when I was a pediatrician before kids, and I'd be talking to parents and I'd be like, you probably know more about this than I do because experience the
Yes, yes, yes,
there's a
yes.
whole nother layer to it. And I miscarried my first baby, and that was definitely a journey. I was in residency, and then I got pregnant again, and then my son was born at 31 weeks, and so there was my
Mm.
NICU baby. And so it was interesting. I always feel like, we are, the things that we go through are to prepare us for the things that are ahead. And so I struggled when I came home, like it was just me, my husband, and my son, and our family we're from Louisiana, so we're on long here in Georgia, and the child care struggle was real, okay, because I was still in training, so I struggled with the guilt of having to go back to work, having my preterm infant at
Mm.
home. He had to go back on NG feeding, so that's where a tube go down to your stomach to help feed the baby if they can't like swallow well. He was still getting stronger in that area, and so trying to teach people how to manage the G-tube feedings. It would be from family or work friends, and even some of my co-residents. Thank you, Dr. Lily, helped me during that time. And so it really became real to me, like the struggle that moms go through, that
Mm.
guilt and anxiety. Even with me being a doctor, I still was worried. I remember one time I got called. I was in the middle of sign out, and my little cousin was like, "I've had to call 911 because Liam started choking." And I like dropped everything and like flew home because thankfully I lived like right around the corner from the hospital, and my
Right.
nerves was just shot. And so just that experience, and then my daughter was also preterm, so I've had the premature infants, I've had the worry about childcare, the guilt of going back to work, the what am I doing? Everybody says it's supposed to be the happy time, and I feel more stressed than I've ever been in my life. I mean, I felt like being a resident was easier at that point. And
Mhm.
so the compassion really developed even more once I actually started working in the NICU and working with my families, and seeing how people have to really work through transition. Like becoming unstuck when the unexpected happens. Like you go into the hospital to have your baby and you're thinking everything's going to go well, unless, you know, in your pregnancy, somebody's kind of told you they're worried about something. But
Right.
for the most part, you show up, you think I'm going to have this baby, I'm going to go home in 2 days, and, you know, we're going to do our thing. And then, you know, you end up having a preterm infant, or the baby's not breathing well, or the glucose. And so it became important to me to help those families feel unstuck. Like, all right, let's deal with this situation and learn how to move forward. So you're not in this cycle of I'm overwhelmed, I'm anxiety, it's worry. It just doesn't help you in any way. So that's really what this business was born out of. Like, I want families to be able to enjoy this time and
Mhm.
know, hey, yeah, things are going to be happening, but you can be empowered to manage your life and your momhood with some power and some encouragement and some confidence.
Awesome, doc. I like that. And even for those who didn't, don't have like preterm babies, or
Exactly.
it's still a challenge. I can relate to with my first child, a similar experience, but just being a mom during that phase can be a little tough, and it's good to have a community. So I like
Yes.
what you do. Now let's talk fourth trimester, because some people are probably wondering, well, I thought there was only 3 trimesters. What's the fourth? So what's the fourth trimester? If you don't mind, kindly explain it.
Yeah, so the fourth trimester is basically that period after you've had the baby, and it's the period of adjustment for both the mom and the baby.
Mm.
So the mom is undergoing physical and emotional adjustment. You know, it's funny, we tease people about those pregnancy hormones, but it's a real thing. Like your
Yes,
estrogen and your
it is.
progesterone are elevated, and now they're undergoing some adjustments trying to get you back to a normal or your
Mm.
pre-pregnancy level. And so moms are sometimes happy and then sometimes sad. And think about the ups and downs of that. That can just make anyone feel like, am I crazy? Like, why was I just smiling and then I bust out into tears? And that's a real thing. So you're dealing with that. You're dealing with the, like you brought up, a new mom. You know, you have all these books, what to expect when you're expecting, and all these things. People can tell you everything, but it's not until
Mm.
you're walking that path that you really discover like what you're feeling about it. And so that's going on. And then your baby, you're learning this person that is new. And is that normal that they like their eyes are kind of looking at their nose sometimes, or they looking to the left or the right,
They
or
do this.
they shake like the startle reflex, and like, oh my god, are they shivering jittery, are they cold, or hey, they pooped every time, is that normal every time I go to feed them, I got to change their diaper? I always laugh at the hospital whenever the parents are like, they pooped again, like when I go to check them. And I'm like, that's for the rest of your life until they're potty trained, okay? It's like round the clock, okay? And so it's not like any other job. This fourth
Mm.
trimester is that transition of the mom's body, mentally, physically, emotionally, socially. Every aspect of who you are as a person is different, because you've only had to be concerned about yourself up until now, and now there's another person that's relying on you, and it's more personal, right? Like, even if you have a job that you go to and you do the work and you come home, you somehow manage to separate yourself from that. Your baby is there, they're yours. I always tell people, it's not like when you're babysitting, it's a finite time you're gonna give them back. Like, all right, your mama come to pick you up at 6 o'clock. No, you are that babysitter. And so you have to like manage to take time for yourself, actually. And I always encourage my families at discharge, don't forget about yourself. When you are well, your baby can be well.
I'll be honest with you, just remembering what, some of the circumstances. Like, I remember when I first got home. So my son had to be in the hospital for, 'cause he was born 34 weeks. We had PPROM, so we were there from 24 weeks to 34 weeks. And
Yeah.
when we came home, he had to be in the NICU, so I had some days. And then when he came home, it hit me that everywhere I went, I had to make accommodations for what would happen. I'm like, oh my gosh, like
Yes.
my life has changed.
Yes.
Sometimes it doesn't hit you; it hits you at different phases, and that realization can be a little scary. So it's good to have support. But yeah, I can relate to what you're talking about. Now, for trimester, you defined it. Is there a way to prepare for it? You've alluded earlier that your books and but are there tips on how to prep yourself for it so it's not as shocking, I guess?
Yes. I think that definitely thinking about the support. I think it's the biggest thing that you can try to arrange. What kind of support can you have in place? what kinds of things you can arrange for your house, because your life is still ongoing. Like I tell people, you can't pause, like that your bills have to be paid, that your house has to be clean, that you need food and laundry and all these things. And those are the things that rise up and can add to the overwhelm of, okay, I'm trying to just take care of my baby, but all these other things are still, happening and need to be addressed. So if you could think about your situation, because everybody has different situations. Like I alluded, my situation, I didn't have anybody that was physically there. I had to arrange, like, okay, I had to plan, is really developing a postpartum plan for yourself as much as you can, understanding that that plan can change and it may not even work out like you like. And so it's kind of just like life in general. Like I'm sure as moms, sometimes we put a pressure on ourselves because it's the baby. But if we think of our life already, there have probably already been things that we've had to manage unexpectedly, like this happened, or I got this diagnosis, or this financial thing happened. And so being able to be like, okay, what will I do about it? Or what can I do to help me get to the place that I'm trying to get? So I think the fourth trimester impacts everything, like mom, baby, your relationships, your home, and your return to work. Those are like the 5 pillars I think people need to think about while they're pregnant. And again, it's hard almost to kind of plan for it, because you can feel like you'll be a certain way or need a certain thing and come to reality. Right. It really was a different than you imagined, or the support was not the way you wanted it to be. But you can try, at least you can be aware of the fact that these are the areas that are going to be changing in your life. And what do you want them to look like? What does returning to work look like for you? Okay, like what is your job's responsibilities, right? So let's focus on return to work, because that's one of the ones recently I've been seeing a lot of people in Facebook groups and things talk about and kind of get distressed over when they have to leave their baby and go back to work. And so it's knowing what is your job require. Like everybody has different return to work financial situations. Some people can take off 9 the whole year. Even like we have a couple of our nurses that are pregnant and they're going for like 9 months and things like that, because of the policy of our hospital. They have that kind of support. So that's good. Wow. But figuring out who can come and help you, what daycares you might like, or if somebody's going to be able to come to the house and watch your kid while you go to work. Those are the things. What's your financial situation? Do you need to start saving up a little bit while you are maybe still working while pregnant to be able to afford to stay home a little longer? And it's because I didn't even really think about that while I was pregnant. I was just hoping I stayed pregnant, because you hear so much stuff about I already had a high risk pregnancy. So I knew, oh my God, I'm just hoping that my child makes it this time. That was my premier concern. So, or, if you're not having in high risk, you're like, what color is my nursery? What am I going to name my baby? And, all the fun stuff, that is fun. And that is good to consider. But the other parts do need to be addressed. So thinking of your family, talking with your partner, spouse, caregivers in your family support system, even talk with them. Hey, what does it look like for you when this baby comes home? Because some dads are now able to take paternity leave, having an aunt, a grandma, or someone come in. So it's really, what would be your best postpartum experience? What would that look like for you? And kind of starting to put those pieces together is my suggestion.
Support systems are key. And I tend to encourage moms too, there's some things that others cannot do for you, like breastfeed, right? So things that others can do for you, and they ask, how can I help you? Allow them to.
Yes. Have somebody cook some casseroles and drop them off at the house, or arrange for someone to come and clean up. And one of the things is you don't have to do everything every day, and understanding that you might have to change how you managed your house beforehand. So like me, Fridays is like my day to do like the mopping, the sweeping, like thoroughly all throughout the house. And then just otherwise I'm just tidying up things, as I go. I've taken that pressure off myself, because I know realistically I was not going to be able to do that every day, but I can make a laundry day like a Tuesday or Thursday or Saturday. And then again, having a plan makes you feel empowered and in control. Like, okay, I've already decided how I'm going to do this. And it can take more of the anxiety away. And as new moms and parents, period, we get into this comparison of what somebody else is doing in their home or what's working for so and so. And you have to be willing to let that go as a mom or parent, or you will definitely increase your anxiety and your overwhelm, because what should anybody be doing? As long as you and your baby are healthy and well, and, and clean. Obviously, we all want to be clean. That's part of health. But that's different. Like, you don't have to do laundry every day. You really don't. Like, that's not being dirty. That's managing your time. And so just, there's just ways to do it, but it's figuring that out for you and giving yourself some self-compassion. Moms need self-compassion.
Mm, That is so true. That is so true. And own your own journey.
Yes.
Yeah, own your own journey.
And
Now,
run your own race.
own your own journey. All right, let's talk first-time moms.
Okay.
And I don't think this only appears or occurs with new-time moms too, but the fear of not being a good mom.
Yes.
How do you tackle this one?
Again, a lot of times people, a lot of that, what's a good mom, comes from comparing yourself to someone else. It's either that, or you may have had a preconceived, so how you were raised may factor into your thoughts about it.
Okay.
And either you liked how you were raised and you're trying to measure yourself up to that standard, like, well, my mom was able to do X, Y, and Z, right?
Mhm.
Or you didn't like it, and so then you want to do something else, but then you still feel like you're falling short. And so being a mom and a parent is a progress. It's a progress. You're
Right.
not going to just parenthood is on the job training. So you really have had no prior training to be considered a good anything. If you think about it, like when we call ourselves good at something now, it's because we felt we've developed this skill over time,
Mhm.
to where we're just like operating in the zone of genius, like Dr. Uda likes to say, and we're just smoothly doing it, right? That's like when you usually typically feel good about something. Well, you had no time to be like anybody else's mom. They didn't let you go practice.
Practice. Mhm.
You didn't have an internship. You have a baby and you are a mom. So to me, you're always starting off good because you've done it. You have had a baby, and so now it's learning what kind of parent you want to be. And like you said, enjoying that journey. Look at it as I'm figuring out who I am as a mom, because you probably were still trying to figure out who you were as a woman. Like, I feel like I'm still trying to learn that while raising my kids. I'm still trying to figure out who is Dr. Jess Daigle and what does she want to put out into the world, right? And so I still feel like I'm a good mom. Why? Because I love my kids. I want to make sure that they grow up and be productive members of society, that they have the things that they need. To me, that's what being a good mom is, that you are aware of the fact that you have an impact on your kids. So that awareness is the first step, and then you will make changes as you need to, as you learn more, because again, you still have to learn too, right? Just like any job, you learn, your skills get better, then you feel good. So I think we should take that out about good and bad mom. And it's like, am I providing the love that I wish? And if you feel like there's something you should be doing, then just do it. Like, I had a mom in a Facebook group that was like, I went to visit my mom and I was playing games with my mom while my toddler was crawling around, like, outside on the blanket playing with her toys. And I felt bad because I wasn't interacting with her. Well, kids and toddlers want to explore their environment too. Sometimes they don't want to be bothered with us. They want to do their own thing too. Like, everybody wants to be to themselves sometimes and just kind of have moments and stuff. And so paying attention, smiling, holding your child, like when you're there with them, being present in that moment, that's more important, like the quantity more than the quality. Because you can be at the house with your kids for 24 hours and still not be like engaged with them. But if they come up to you and want to talk about something, okay, are you listening? Are you giving some advice? Or are you laughing when they come to show you something silly? Or are you kind of like, get away from me, child? Then I'd be like concerned about that. But other than just you existing with them in the house, it doesn't mean you have to be interacting with them personally for those 24 hours. Sometimes it's just being present, them seeing that you are there for them if necessary.
Awesome. I like that. Quality over quantity. So being there when you're there, the times that the disengage is okay. The babies can be on their own. Of course, as they get older. Quality over quantity, being present, and you can even batch love. I don't know how else to
Yes.
explain that. You know,
Yes.
batches. You're there, no phone, no social media. You're present with them,
Yeah.
you're smiling,
It's
and
a decision. It's a decision, and it's fluid. They're gonna. It's not predictable. Like, it might be like this day. You can make days of it. Like on Tuesdays, like me and my son. Okay, so this is an example. When I pick him up from school on Mondays and Fridays, I used to do it a lot, but I told him to keep getting into my pocketbook too much. But we go to Starbucks. Like we pick up school, Monday afternoon, that's our thing, and so
Mhm.
having that, like that expectation, like with kids, routine is important. That's a little tip for parents. And so just being able to know, hey, on Mondays, me and my mom, we're gonna go get our thing. That is going to be a memory. It's about those experiences of building those memories that they can look back on. And not that we have to do that, like that's because I'm taken to the Starbucks, that's the love, but that shared, like we like that together. And so we're gonna go do that together. And it could be simple as going outside and riding the bikes or taking a walk or just, hey, how was school today? Just being present. Those are just like some examples of how I do it in my house. Because I'm a doctor. Like I spend probably the majority of my time at work actually. And so then I think you probably feel a lot more guilty when they're younger. But because babies and everything, but when you get older, to me, that was the time I didn't want to miss the more because they actually can talk to me and interact and I can hear their thoughts about things. And so that's actually for me the time I started to feel more guilty as I got older than when they were babies and I was having to work because I was like, well, I'm interacting with them when I'm at home. They don't really know that I'm not there, like in their mind right
Right,
away.
right.
So like how my son can appreciate, like, oh, mom, what time are you gonna get home? That kind of thing.
Right, right. Gotcha. Now, we talked about the mindset of, the fear of being a good mom, but what are other common mindsets or fears that you see with moms who just had a baby? If you mentioned maybe two or three, and how have you addressed it, or how do you address it?
So one of the biggest things is the fear of like missing something when they're asleep, right? So babies are often up. They're up a lot. Well, not a lot. Let me rephrase that. The babies sleep a lot, but they can be up when you are asleep. Say, like there might be a period where you're sleeping and they can just be up, especially as they start to get a little older and they're looking around. And so I know some moms are like, I'm afraid to go to sleep because I might miss something, or they might spit up, or they might choke, or things like that. So that's like a real concern. And so what I usually tell families is that's everybody's concern, and there's really nothing too much that can take that away. They do have like products that are out there that
Mm,
kind of monitor the heart rate and oxygen, which when we used to send families home with those monitors from the NICU, we actually found that it increased their anxiety more because the thing, like the baby will flick their leg and just moving or kicking their leg will make it go off, and then they'll be all up thinking that the baby's not breathing or the oxygen is low, and it's really
mm,
the baby was moving the monitor. So it's really just, I think for me, it's like doing what I can that's in my control, but I trust the Lord at the end of the day because there's only so much that I can do anyway. So I actually try to encourage my families to just trust it's going to be okay. Do what you can, obviously, like making sure your baby's in a safe sleeping environment on their back, in their own crib,
mm,
that can
mm.
play on a firm surface. No pillows, big blankets, stuffed animals, all those things that can crowd their headspace and things. And just do your best to birth them. The other thing that is a bigger one is the breastfeeding. Okay, so you probably heard me say, like, you always see these videos of moms, like the baby's latched on and they're looking down and it's all serene looking. But that's not how it looks at first for a lot of moms. It's a lot of um, the baby may not want to latch, or they're very sleepy and you're trying to keep them awake and engaged on the breast. And you're worried if you're making enough milk, and are you sure they're getting enough? Because
Right,
really, when you come home, like, you really just have to keep them fed and safe. Like, and there's only a couple of things babies need to do: eat, sleep, pee, and poop. Right. And so you're like, man, if you don't feel like you're breastfeeding, well, that people take that personal and they internalize that. Like, oh my God, I can't even feed my baby. And then that kind of ends into a spiral. So I'm on this mission to normalize and strategize. Okay, like let's talk about what really goes down when you're breastfeeding and how to stay engaged and encouraged. And so that's what one of my upcoming webinars is about too. I just want to debunk this. It's just going to be like a smooth ride. No, it's work, but you can do it because parenting is work, but we do it. Like going to our jobs are work, but we do it. We show up. And I think that's one of the good things about women. We show up and we should feel empowered in that. Like, hey, I am capable. I can do this with the right information and support. So I'm about education, counseling, and reassuring families, because when you know something, then you feel more empowered to walk in it.
I like that. And I like that you encourage and help patients or parents or moms through the phase of breastfeeding. Of
Yes.
course, if you can, you should. I tend
Yes.
to encourage that. And if you can't, it's okay too.
Yes, I'm not a shamer. I've seen a lot of people, and there's a lot of arguments in the community about the fed is best and the things like that, and who's promoting that. And I think, obviously formula companies have a stake in people eating formula. It's a business, right? But at the end of the day, I think as long as you have the right goals and you've been armed with the right information, because some people have medical indications why they can't breastfeed. And so it should not be like, oh, like, no, again, what's your journey? Did you try? Did you have the right information? I didn't breastfeed all the way until they were 1 year old. I stopped about 7 to 8 months, going back to work, trying to pump and do a lot of stuff became more challenging for me, especially working in the NICU. But I've always been impressed by my colleagues who have gone 1 and 2 years, and I was capable. But for me, mentally, it was just better to transition myself out at the time that I did. And I did have some guilt about that because I'm a doctor, I'm a pediatrician. I'm like, hey, breastfeeding, no, it's like at the end of the day, my baby's going to be starting to eat all kinds of other things. They're starting to eat solids. They're doing things. It's okay. Like I still felt like a good mom because I cared about them eating. I still cared about their well-being. And that's what I want for our moms.
And it's not a competition. I breastfed for 2 years, and I'm like,
yeah,
it's good. That's very good, actually. But
yeah, that is. Yeah.
Put on breastfeed for 3
And
months.
again, that's their decision, and they were empowered in that. And so that's how everybody should feel empowered in their journey. Because again, who wrote the book on what is right? We look at what's beneficial, and I definitely try to use evidence-based medicine with practical, things to merge when I encourage my families. But I never want anyone to walk away feeling shame. That's not a place to be in and to live in, and nobody should have to live like that.
Okay, awesome. And I wanted to mention, someone had made a comment. It was Dr. Giovanni. She said, my daughter's almost 12, and when she was born, one of the most important decisions I made was to put down the phone, social media, to focus more on her and the moment. So MOMENT.
Yes, I love that.
I love that. Highlighting some of the points you've made about being present, about quality over quantity.
Yes, awesome. Like enjoying like those little things. Like even now, I like just will sit on the couch and just watch my kids' antics, like they're chasing each other around the house, and I just will smile at that because I love like the freedom, and that's why I love pediatrics. Like kids are just free to be themselves. We can learn from them. Even the Bible it says learn from little kids.
And there's something you mentioned, about the trusting, and this is really, really important. I wanted to share real briefly. I remember when my son had come home, and of course, as a physician, babies should sleep on their back, SIDS and all that, but I had this habit of just staring at him. I would just stare and watch him sleep, make sure he was okay. And I remember one day I was woken up by my husband, and he's like, there was actually an issue with my son, and I didn't recall, because I was so tired, because I've been spending time just staring at him. Yeah. And so it really hit me, at some point, I'm going to have to go to the bathroom, take a dump, travel, go somewhere. I wouldn't be with this child all the time. And that's where, faith, and you share that, has been big. I have to trust in God that it hit me. This is a gift from you. I can't do this on my own. I can't always be there to watch this child. So I'm going to do my part. I cried like a baby, like, oh my God, like it hit me. I can't always be there. Yes. Oh my God, you have to trust, do your part. And the rest is really out of your hands. You just trust.
Yeah, I love that because when my father-in-law, it's unrelated, but this has helped me with my parents. When my father-in-law got sick, it hit me like, we belong to God first. That's what I believe. right? And like you say, he's a gift. And so who cares for us even more than him, right? Like he created us. And so yes, we're stewards, really. We're stewards in the earth of everything that we have, our money, our time, our relationships, our kids, our jobs. It's all for a purpose. And so what I take into is just praying when I have anxiety. Even now when I leave and I go to work and you see all these school shootings, all this stuff, and I drop my son off at school, I just pray, I'm like, Lord, I just cover him, please, because I don't know. I can't be there and I can't bring him to work with me, even if I wanted to, even if I homeschooled him, he's still gonna be at home. I'm still gonna be at work. Like you can't, you're right, you can't bring them everywhere. And then I tell my parents not to do that because you will eventually fall asleep. Because remember, it's around the clock when they're a baby. Like you only have so much, even on a job that you are like, say when I would used to be on call, like a 36-hour call. Okay, yeah, I made it that 36 hours, but eventually I had to crash to go to sleep, like because it's on repeat. Again, you're not babysitting your baby; they're yours, like they're your child for forever. So there is no time that you're going to be able to really separate yourself from them. It has to be a decision, an understanding that okay, I need to rest, and that brings up another point when people talk about sleep when the baby sleeps. And I used to tell people that. And then when I had kids, I realized that's when I want to do everything else that I feel like I need to do. Like, like that's when I want to go like watch a show maybe I want to watch or like that's when I might need to cook dinner or do that load of laundry I said. And so you only can do that when you have support. And so when I because of my experience with my son, with my daughter, I did have someone come and be with me at the house. And so she would help with the cooking and things, and then the laundry and stuff. And that definitely did help me to go to sleep when my kids were sleeping because the other things that needed to be handled were being helped. And so, again, if people don't have that kind of resource, I was fortunate to have that then, but that's not something I would have been able to afford as a resident, which is why I had to do it the way I did. Like I had, probably 3 or 4 different people in rotation helping me
In
and my
rotation.
in
Yes.
rotation. I do that now. Like my mom and 2 of my aunts come and watch my kids rotation so they don't feel tired. So I can keep them on the team. You need a team in business and you need a team as a mom. Okay.
Yes,
So
yes.
I said this yesterday. She said Jesus had 12 disciples, so she needs 12 people on her team.
Awesome. And I'm really hoping for those who are watching that you're able to leverage support systems that are in place for you. Here where I am, there was a group, there's a moms group, before COVID hit, where all the moms, would kind of come together, would meet every so often. And then those who were pregnant, the goal was when they had the baby, everyone would take turns making food for them every week. And that was donated, like it was a community. It was built. It was thought of. It was someone's idea, and I thought that was beautiful. We're new here, and the lady, those who had the baby were new here as well. So that's a very good thing that someone could start, initiate on how to support moms through this transition. Moms need to support moms as well.
Yeah, I think that's very in my community, we get something going. That's a good idea.
I concur. Now, next question. Self-care, not selfish, like self-care versus being selfish. Sometimes it's hard to negotiate that balance. How do you negotiate, like that conversation, like where, people don't feel that taking care of themselves is selfish, but self-care is important. How do you navigate that?
Okay, so it's understanding that the only way you can best take care of anyone is taking care of yourself. Because again, you only have so much capability in yourself as a person. And so the understanding that you are still important too it really is a cultural thing here in the US, because other cultures and even other countries, they still herald the mom. It's like basically it's like she's pregnant when she's even had the baby, and they encourage people coming to the home and giving that support, and the moms like having time to themselves and someone else tending to the baby, because it is mentally challenging to be everything for someone all the time. Think about it. Like we're incapable of doing that. And so it's not selfish when you are doing it out of love, when you understand why it's important for you to take time to breathe and to reflect on yourself. And self-care looks different from everyone. So it's not necessarily going get a pedicure and getting your nails done and getting a massage. It could be just taking time to breathe, go exercise, take a walk, whatever makes you feel like your best self. To me, is self-care or brings you joy. And it could be it could be anything. It's just you taking time to say what makes me feel like myself mostly, and me feel good in who I am, and then doing that. And so that's definitely not selfish, because again, like we talked about, quality over the quantity. And so I answered one time, a mom in a Facebook group was kind of sharing that same thing about one, and I told her I like to have time away from my kids. I was honest about it. I like the idea of just taking a drive sometimes and just listening to some music and I'm jamming.
Store by yourself.
Huh?
Going to the grocery store by yourself. That's
or just walking, or just journaling, or just sitting out on the patio and taking in some deep breaths and just reveling in the beauty of nature and just things like that.
They're good. They're good. You're a mom. They're good.
Yes, I told them I was going to be on this live, and you think they would consider that, right? But yeah, so just it's not selfish, because it's important, because you want to think about what you're going to be teaching your kids too, right? You want to teach them to make time for themselves, that they too are important, even in any situation that they're going to be in. And so we have to lead by example. And so by them watching us say, hey, you know what, my mom was okay with, taking some time for herself or putting her needs first when she needed to, that's okay. Because I even have those conversations with my son is like 8, so he understands a lot more, but we talk about it. And so it's just important to do it. And it's mental health. I had a friend that said, like, the best gift you can give your friends is mental well-being. And I thought about that. Like, that was so deep, because we are always trying to do other things, like give them clothes, give them money, give them experiences, give them this. But us being our best self is giving them the best thing that we can.
I like that. And I have a question coming up before we go ahead. She asked, and that's a very good question. How can we support a new mom safely in this pandemic? As non-pediatrician physicians, what can we do to help new moms or pediatrician colleagues? Wow.
Yeah,
That's
that is a good question, because I just saw like a report recently about, like, I think it was like 40% of moms, like, in this pandemic were more stressed and like more overwhelmed, even the ones who are like working and employed, especially, and how moms were experiencing burnout. Think of that. Think about that. We've been talking about I think everybody in the country, in whatever area they're in, is experiencing burnout. And so I would say, because thinking about things like postpartum depression, anxiety, I recently had a live with Dr. Chen, and I asked her, like, when should we also, for the same reason, like, it actually can start while you're pregnant. And I had never thought about that, because we call it postpartum depression.
right.
But a lot of it actually starts while people are pregnant, and especially if they have a prior history. So the way to support a mom is to really, really, one, talk with them, have a conversation. Okay, you're pregnant. What are you feeling right now about being pregnant? What do you want for yourself, like, after you've had the baby? Again, encouraging them to even think about it, because again, we're caught up in the I don't want to use the word superficial to mean like it's not important, but more of the outer things, like the color of the nursery and the name and the getting the supplies. Like, we're good about getting all the things we will need external, but we have to be aware of internal what's going on. And so it really takes that being genuine and saying, hey, I'm checking on you because I really care and I want to know, like, what are you really thinking? And when somebody's just like, I'm okay, like don't just like accept that as like okay, what does okay mean for you? Is there something that would make you feel, what will make you go from okay to I'm feeling great, or I'm feeling ready, or I'm feeling like a different word. A lot of times we group emotions into these broad terms instead of getting into the specifics, and then supporting them in that way and encouraging them that hey, I know you want to shoulder all this on your own, but you don't have to. Because again, as women, it's this mark of, oh, I'm a woman, I should be able to do it all, right? Like, a lot of times we taught that as something to be proud of, and we should be, because we are capable, but we shouldn't have to be. So what you should have to be and what you are and all that. Like you have to work that out. Okay, can you do a lot of things on your own? Probably. Should you? No, you shouldn't have to. You're not meant to do things alone. Most things work when you have a team. If you look at any business, the ones that are really successful are the ones that have teams and people in place to do different things and operating in their best.
And sometimes people say, well, they can't do it like I can do it, or this and that. But sometimes you have to teach people how to help you. You have to
Yes.
spell out to them, like, this is how you translate love to me. This is how you
Yes.
translate concern to me. It's
Yeah.
okay to teach them that.
Yes.
Like, you know what? I got to do it all by myself. Because if you
Yeah.
break down everything that you're concerned about, everything that's tied to you, will also, will struggle. So it's really important.
It really is. Like if you think about it, you're not really giving yourself that love that you need. And you do need to love yourself and respect yourself enough to know that I do, like, asking for help is actually a sign of strength, because it's recognizing that we all have different things we're good at. It's actually appreciating, like, thank you, because I needed somebody to do that, like, like cook that meal or come help me fold my clothes and stuff. And I was really bad about that. I've learned how to do that over time, and it's really made a huge difference. And it's allowing your kids and stuff too to have other experiences and learn from other positive people in your life. And even you, like, you might learn something that you didn't know, a recipe that I didn't even know I would like that broccoli casserole or whatever somebody make, and then that adds to you. And then it feels good to when you really sit down and think about it, like, who, like, because it sounds fun. Like well, I used to think, well, it's only an hour. Like say if I'm trying to put a meal together, or it's only like 20 minutes, but that's still 20 minutes. I could have just sat down and
nap. What a power nap.
Yep, just take a good breath. Even like just knowing in your mind sometimes that you didn't have to do it is free. Like that makes you feel more empowered.
Awesome.
At least it does.
Awesome. So, Dr. Jovan, we highlighted a few things: checking on new moms through the pandemic, call, ask them. You can send videos. I love with the iPhone, you could do a emoticon, like
Yes.
an emoji video, and send to people to encourage them.
Of you.
Ask and just say, how are you doing? Is there anything I could do to help? And things like that. So I like that she brought up that question. Now, the next question I was going to ask you, or the last question I was going to ask you, let's talk red flags.
Yes.
Red flags in the fourth trimester. What are red flags? Give us one, and tell us how to kind of look out for it from the people around us, our loved ones, and what to do in those situations.
Well, the biggest thing that is two things, like health wise, making sure that if moms are not really feeling good physically, that they really are communicating with their doctors. Because, like, since this is Heart Health Month, heart disease can happen in pregnancy too. And sometimes moms can be thinking that a lot of things are quote unquote normal, part of pregnancy, but they can actually be signs that they need to be checked out. So like pain in their chest, a lot of swelling in their legs, changes with vision, things like that, severe pain, any kind of spotting or bleeding, definitely checking on yourself and getting to the doctor. But then so that's the physical piece for as far as red flags. For mentally, it's one, to be isolated. So you're worried about depression, postpartum depression, anxiety, and psychosis. And so there's a normal amount of anxiety that comes with pregnancy, just because, again, you don't know, you're kind of a little bit hoping that things are going to turn out right for you, or especially if you're not a new mom and you've had a pregnancy before that has some complications, you definitely worry, will this one be like that one? Or as a new mom, will you even have complications? Will it go smoothly? Because you may know someone who've had a bad outcome. But really looking for moms who are like isolating themselves, like you went to check on your friend, like she used to, be talking to us, or she used to answer my texts or my calls. She's not answering my texts and my calls. Someone that's worried about everything, like all day worry, and they can't get out of it, and it's just like everything in their life they're worried about. I would be concerned about that person heading into postpartum anxiety / depression, and really just not wanting to eat, like the traditional signs of depression: losing interest in people or things they love, not wanting to eat, wanting to excessively sleep. Like it takes all of their energy just to get out of bed. Like just the thought of doing anything that they typically would do for themselves seems
Mhm.
exhausting, and then have no interest in it. Those are red flags. And then for postpartum psychosis, which is rare, but one of those things that we've seen through Facebook, a couple of different physician colleagues
Mhm.
have had issues like suicide from postpartum psychosis, and that's just like when they're just totally separated from reality. So if you have a mom in your life that you're like, she's saying things that I'm not sure about, or her behavior is different, getting them some help immediately, because that might be a sign that they're on the verge of like a mental breakdown, and time is of the essence in that case. So just don't, when somebody says I'm okay, like we do that, like I'm okay, you know,
Good.
really
Good.
pay attention. Like, do they look convincing? Um, Ask them a little bit more specifics. Like, okay, you got your things you need for the baby. Okay, what about you? Like, what are your things you, or have you done something for yourself today? Did you do something you enjoy? Like really teasing out those details, kind of making them talk a little bit more about it. I think that'll help us, just even in our community with the high rates of suicide that we've been seeing. It's just making sure that we don't keep it surface level, that we really dig a little deep, especially for the people we're close to. Like, now, somebody may not just randomly want to tell me that if they don't know me, but someone
Right.
that's really closer, we have that opportunity, that trust, that bond there. Push through that, to show them that you're really present for them too, and want them to be their best.
I love that. Dig a little deeper. Checking on
Yeah.
new moms.
Yeah.
Checking on new moms. That's important. Support
Yes. Yeah.
others.
Look, when our nurses were pregnant, one of them, I've been texting her, "You okay? How's that baby? You any pains? You got to check." Yeah.
I agree. Awesome. Awesome. Thank you so much, Dr. Jess Daigle. It's been awesome. A lot of information, a lot of encouragement here. For those who are watching, please share with those who could, benefit from this. We could all use some encouragement,
Yes.
as we navigate this journey as moms. So this is big. So now, for those who are watching, who are like, this doc, I like her vibe, I like her smile. I would like to connect with her, like to have her on as a speaker, or sign up to work with her. Where can people find you?
Okay. So my Instagram is at momandme_MD. And I have a landing page currently, www.momandmemd.com/stop overwhelm, because that is my mission. I want to stop overwhelm in moms and help them feel confident in their new life and embrace their momhood with confidence, right? We got to rock this thing. And so on Facebook, it's just Jess Daigle, like my name. And so on there, I post different things. I'm doing a webinar coming up on breastfeeding, how to stay the course, talking about how to stay encouraged and keep up the stamina and your milk supply and all those things. While you're breastfeeding, because that was a concern with a mom that I had recently, and I was like, this might be a good topic to talk about, because really, some people are dealing with some trauma even after having babies, and your breastfeeding journey can start out kind of traumatic depending on who's helping you and or who's not helping you and things. So I want moms to have a good start.
Thank you so much. And what I'm going to do is, when I'm done, for those who are watching, I will put her information in the YouTube page, and I also put it um, on the Facebook page as well, so you know how to reach out to her. Thank you so much for doing
Thank
this.
you.
And I have a comment here from Dr. Jovan. She says, "Great, pertinent discussion. Wish I had you both 12 years ago." And she says a big thank you. So just wanted you to
Well,
see that.
thank you. Thank you. I know. That's why I'm on this mission.
You're probably like, "I wish I had me when I was
Yeah,
with my."
me too. I really did have, like, when Liam came home, he, like I say, he was preterm, and I remember the first night he like choked on his formula, and he had not done that in the NICU at all. And so I was able to call the neonatologist, and she talked me through it. And so having someone like that, I was like, even when I had to put his NG down myself, she talked me through that. So, and I had so I had that like what I want to do for moms. I did have it in a little short bursts there, and so that's why I know having it would help. It really grossly drove my anxiety down, just because I knew there was somebody like a phone call away.
Awesome, awesome, awesome. Thank you all for watching. Thank you for coming, Dr. Daigle, once again. Now, if you or anyone you know is looking for an awesome family physician that's thorough, that's passionate, and that's caring here in the Mansfield area, I am she. I'll see you in a bit, okay? Have a good one.
Bye.
Bye.